Infectious diseases are disorders caused by organisms, such as bacteria, viruses, fungi, or parasites. These organisms are also called pathogens. They can enter the body and multiply, leading to illness. Some infectious diseases are contagious, meaning they can spread from person to person. Others are not contagious and are acquired from the environment or animals. Infectious diseases have plagued humanity for centuries. From the Black Death to the COVID-19 pandemic, these diseases have shaped history and continue to pose significant threats to global health. Understanding the causes and modes of transmission of infectious diseases is crucial for effective prevention and control. Pathogens are diverse and use various mechanisms to cause disease. Bacteria, for example, can release toxins that damage cells. Viruses, on the other hand, invade host cells and hijack their machinery to replicate. Fungi can cause infections on the skin, nails, or internal organs. Parasites, including worms and protozoa, live in or on a host organism, obtaining nutrients at the host's expense. The severity of infectious diseases varies widely. Some infections cause mild symptoms that resolve independently, while others can lead to life-threatening complications. Factors influencing disease severity include the type and virulence of the pathogen, the host's immune status, and access to timely medical care. Infectious diseases can spread through various routes, each with unique characteristics. Understanding these routes is essential for implementing effective control measures. Direct contact transmission occurs when an infected person touches or exchanges bodily fluids with a susceptible individual. This can happen through kissing, sexual contact, or contact with infected sores. Respiratory droplets expelled during coughing or sneezing can also transmit pathogens through direct contact. Indirect contact transmission involves contact with contaminated surfaces or objects, also known as fomites. For example, touching a doorknob contaminated with respiratory droplets from an infected person can transmit the infection. Similarly, sharing personal items like towels, utensils, or needles can spread pathogens. Airborne transmission occurs when pathogens can remain suspended in the air for extended periods, traveling longer distances than respiratory droplets. These tiny particles, called aerosols, can be inhaled by susceptible individuals, leading to infection. Tuberculosis and measles are examples of diseases that can spread through the airborne route. Vector-borne transmission involves insects or other animals that carry and transmit pathogens from one host to another. Mosquitoes, ticks, and fleas are common vectors for various diseases. Malaria, Lyme disease, and dengue fever are examples of vector-borne illnesses. Hygiene plays a crucial role in preventing the spread of infectious diseases. Poor hygiene practices can facilitate the transmission of pathogens through various routes. Hand hygiene is paramount, as hands can easily become contaminated with pathogens from surfaces or contact with infected individuals. Respiratory hygiene is equally important. Covering the mouth and nose when coughing or sneezing helps prevent the spread of respiratory droplets. Using tissues and disposing of them properly minimizes the risk of contamination. Environmental sanitation also plays a vital role in controlling infectious diseases. Proper sanitation systems, including safe water sources, sewage disposal, and waste management, are crucial for preventing the spread of waterborne and foodborne illnesses. Clean and well-maintained environments reduce the breeding grounds for vectors like mosquitoes and rodents. Environmental factors can influence the emergence and spread of infectious diseases. Climate change, for example, can expand the geographical range of vectors, increasing the risk of vector-borne infections. Deforestation and urbanization can also disrupt ecosystems and increase human-animal contact, facilitating the spillover of pathogens from animals to humans. Preventing and controlling infectious diseases requires a multifaceted approach involving individual and collective efforts. Vaccination is one of the most effective ways to prevent infectious diseases. Vaccines work by stimulating the immune system to recognize and fight specific pathogens, providing long-lasting protection. Maintaining good hygiene practices is crucial for preventing the spread of infections. Frequent hand washing with soap and water, covering the mouth and nose when coughing or sneezing, and avoiding close contact with sick individuals are simple yet effective ways to reduce transmission. Safe food and water practices are essential for preventing food-borne and waterborne illnesses. Cooking food thoroughly, drinking water from safe sources, and maintaining proper hygiene during food preparation and handling can significantly reduce the risk of infection. Public health measures play a critical role in controlling infectious diseases at the population level. Surveillance systems help monitor disease outbreaks and implement timely interventions. Isolation and quarantine measures can prevent the spread of highly contagious diseases. Early diagnosis and treatment are essential for improving outcomes and reducing transmission. Seeking prompt medical attention when experiencing symptoms of an infectious disease allows for timely diagnosis and appropriate treatment, which can prevent complications and limit the spread of the infection.